Hello. In this video, we are going to look at some normal gastrointestinal tract and pancreatic tissue contaminants that we may encounter in smears from EUS-guided FNAs or endoscopic ultrasound-guided FNAs. EUS-guided FNA is often used to access masses in the pancreas as well as in the wall of the stomach or duodenum or esophagus. And to get to the target, the needle must traverse some normal structures first. So it is important to recognize these normal contaminants so that we don't mistake them for lesional tissue. This is one of the commonest things that we will see, and we can see a flat honeycomb sheet of glandular cells. And over here at this edge, we are able to see that the cells are actually columnar in shape. The nuclei are extremely uniform and very regularly arranged. And we can also see these empty holes or spots that overlie the sheet of epithelium. These are goblet cells. Here is the air-dried smear. Again, we can see a very honeycomb sheet of uniform cells with browned nuclei and these empty spaces which actually represent goblets. And as we focus up and down, we can see the goblets on this plane, and on this plane here we can see the nuclei more clearly. This is normal duodenal epithelium, and we may sometimes see this when the needle traverses the transduodenal route. So this is usually to get to pancreatic head lesions, and we would see honeycomb sheets of glandular cells with some interspersed empty spaces, which actually indicate the goblets in the goblet cells, as you can see the goblet cells here. Sometimes we can also see these finger-like structures, and the cells within these look quite nondescript and not particularly well or uniformly arranged, and this is actually the lamina propria in the villi from the duodenum. So we may sometimes see these naked tissue fragments of lamina propria. On higher magnification, we can actually appreciate the components of the lamina propria, which looks exactly the same as what we would see on histology. And we can also see some small blood vessels within the lamina propria, just as we do on histology. This is a very large tissue fragment comprising honeycomb sheets of glandular cells. At the edge, we can see that again these cells have a columnar configuration. This time round, the cytoplasm is very pale and contains abundant mucin. The nuclei are polarized to the basal edge of the cell. In the background, we can also see some thin mucin or mucoid material. This is gastric foveolar epithelium. Again, we can see some honeycomb sheets of gastric foveolar epithelium, and when the cells are oriented nicely, we can actually appreciate the columnar shape of the cells, and we can see that there is a lot of pale mucin in the cytoplasm. Here also we can see some thin mucin in the background. And this is what they look like on the air-dried smears. Again, we have honeycomb sheets of columnar cells with some thin mucoid material in the background. And when we focus up and down, we are actually able to see the mucus cap, and we can see the cytoplasmic borders very clearly, forming this regimented honeycomb arrangement. So this is what we will typically see in benign gastric foveolar epithelium. This will be encountered when the needle is targeting pancreatic body or tail lesions, because in this instance it will generally pass through the stomach. And so we would see honeycomb sheets which are flat with the nuclei being uniformly spaced, and we can see distinct cell borders when we focus up and down, and sometimes we can also see thin mucin in the background. One of the pitfalls is that this may actually mimic low-grade neoplastic mucinous cysts such as IPMNs or intraductal papillary mucinous neoplasms or mucinous cystic neoplasms, and it can be quite difficult to tell apart when the lesions are low-grade. One of the differences is that the gastric mucin is usually thinner versus thicker, more opaque, colloid-like mucin in neoplastic mucinous cysts. Also, in neoplastic mucinous cysts, we are less likely to see a very regular, uniform honeycomb arrangement. Here is the comparison of the thicker mucin that we will see both in the air-dried and alcohol-fixed smears in an IPMN, as opposed to the thinner mucin that we will see in contaminant gastric epithelium. But sometimes it's not so obvious and it can be quite challenging to tell apart. This is an intact tissue fragment of gastric mucosa, so not only do we see the foveolar epithelium here, we can actually see the gastric glands with some lamina propria in between. And here is another example. We can actually see the columns that form the gastric glands and the lamina propria in between. This is a higher magnification picture. Here we are also able to pick out that there are some larger cells with orangophilic cytoplasm, and these are actually the parietal cells in gastric specialized mucosa. So we also have to recognize gastric specialized epithelium, which is present in the gastric body and fundus. So again, usually more distal pancreatic lesions. We are able to see the parietal cells that stand out and are much larger than the adjacent chief cells. And just to compare this on histology, we have the foveolae, we have the glands, we have the parietal cells and the chief cells. And the parietal cells are usually large, polygonal, with low NC ratios and abundant cytoplasm. And the chief cells will often be a lot smaller, and sometimes they can have granular cytoplasm. The granular cytoplasm is more readily seen in the air-dried smears. So these cells should not be mistaken for lesional tissue. And here is something else that we may sometimes encounter, especially in transgastric FNAs. And we can see here there are some sheets or fascicles, parallel bundles of spindle cells. And these cells are actually from the Muscularis propria of the stomach. They can sometimes mimic mesenchymal tumors such as leiomyomas or GISTs. So we are going to compare Muscularis propria with a GIST, and usually the cells in the GIST are more packed together. They have less cytoplasm or higher NC ratio, so the nuclei tend to appear more crowded, and also the nuclei are much longer, more slender, and also more wavy when compared to Muscularis propria cells. Another side-by-side comparison. On the left, we can see Muscularis propria, where the nuclei are quite well spaced. And on the right, we see a GIST, where the nuclei are much closer to each other. We can sometimes also see nuclear palisading in the GIST. And finally, here is an entire lobule of pancreatic parenchyma that has been aspirated. We see here the branching central duct, and these are the grape-like acini that form the exocrine glandular components of the pancreas. So this is normal pancreas. Sometimes the acini are seen embedded within the stroma when the whole fragment is intact. Other times we can see single acini on their own, and this is where we are most likely to mistake them for neuroendocrine tumor because they also look very uniform and can mimic cells of neuroendocrine tumors. So here is a whole lobule that has been aspirated, and we can see very clearly these acinar structures within some stroma, whereas here we can see sort of naked acinar structures, and this is not to be mistaken for neuroendocrine tumors. Here again we have a lobule where we can see the acini, the intact grape-like structures, and a little bit of stroma in between. And this is just to compare with normal histology of the pancreas, where we can see individual acinar structures. So the cells have low NC ratios, eccentric nuclei, and somewhat granular or loose cytoplasm. As mentioned, the SNR cells can occur within intact lobules as grape-like clusters, or they can occur as more dispersed SNR structures. The cells have small, eccentric, uniform, round nuclei and abundant flocculent cytoplasm. And usually we do not see prominent nucleoli, and we don't see salt and pepper stippled chromatin like we would see in a neuroendocrine tumor. So this is a higher magnification view of the normal pancreatic SNR cells. Note the very classic SNR arrangements. And sometimes when we see them dispersed like this, it is easy to imagine that they are actually rosettes from a neuroendocrine tumor. The difference is that usually neuroendocrine tumor cells have higher NC ratios, and the cells also tend to be a little bit more discohesive. They don't form such uniform appearing SNR structures, and also, of course, the chromatin pattern shows a salt and pepper, a more coarse stippled pattern. Here are two pictures which concurrently show pancreatic SNR cells with low NC ratios admixed with these lesional cells from a neuroendocrine tumor, and you can see that the nuclei of the neuroendocrine tumor cells are much larger, and also that the chromatin is much more coarse. Similarly, on the air-dried smears, this is a normal pancreatic SNS, and these are the lesional neoplastic cells of the neuroendocrine tumor, and the nuclei are much larger than those of the benign pancreatic SNR cells. And finally, we can sometimes also see these honeycomb sheets of pancreatic ductal cells. So these would be the cells, the ductal cells that are represented here. And very often the ductal cells tend to have these quite oval nuclei, but they are still extremely uniform, and the arrangement is also very regular. So in summary, we have seen duodenal epithelium, which is recognized as a honeycomb sheet of cells with these goblet cells. We have seen gastric foveolar epithelium, which again show honeycomb sheets of mucinous cells, sometimes with thin background mucin. We have also seen gastric specialized epithelium, where we can see the parietal cells, which are usually very obvious and much larger than the chief cells. We have also seen Muscularis propria, where the spindle cells are a lot less tightly packed compared to GIST. And we have seen benign normal pancreatic SNR cells, as well as benign pancreatic ductal cells. And before I end, I would just like to mention that there are many other cytology-related videos in the same channel in the Cytopathology in Practice playlist. Also, you may be interested to check out our completely free online pathology resource, Pathweb. We have a virtual pathology museum where there are more than 1,000 fully annotated interactive virtual pathology specimens. Registration is completely free, and the registration link is in the video description. Thank you.